Checking blood sugar levels, it can be costly and it can also be painful. Here discussing different ways of doing so is Dr. Jordan Thomas with Delta Health Systems. How are you?
I'm doing well. How are you?
We're so glad that you're here this morning. Anytime someone is willing to come and share all the medical knowledge you have, we love and appreciate that. Now, for diabetics, checking blood sugar, and you say that that's done many times a day, and it can be painful to do so, but there is a different way. Explain what that is.
Well, first of all, what is diabetes? Diabetes is a disease where you don't produce insulin, or in another case, you don't react to it. You're sort of insensitive to it. And so you sort of need to monitor your blood glucose in this situation to know how much insulin you need to give yourself. Now, most people do it by sticking their finger 2 to 3 or maybe even more times a day, depending on what kind of insulin regimen they're on. What the continuous blood glucose monitor is a device about the size of maybe a quarter that you wear on the back of your arm, and it will take your blood glucose about every 5 minutes or so, which gives you, I guess something like 200 to 300 points of data a day.
Wow.
On your blood glucose. And this can be useful for certain kinds of diabetics. I would say that probably not so useful for someone who's a well-controlled diabetic who really has their blood glucose under tight control. But for a lot of people who don't have their blood glucose under good control and are taking it several times a day, for instance, those who are taking insulin with meals, let's say, it gives you a lot of information about what's making your sugar go up and down.
Right. And it sounds like to me that it also is just very convenient in terms of living your life to the fullest, but then also knowing this is something that has to be checked.
Sure. Yeah. I mean, you don't have to stick your fingers so many times. I know one of the complaints is just sore fingers when people are constantly sticking their fingers. And you hardly even notice it's there. Actually, funny enough, that I was asked to talk about this topic. I wore one about a month ago just to see what it was like.
Yeah.
About 14 days is how long they stay on before they come off. I hardly even knew it was there. If you are using this monitor, you would give yourself the insulin separately.
And you mentioned that this information is sent to, on the newer models, sent to your phone through an app.
Exactly. Yeah, that's a good point. It communicates with your phone, sometimes through physically kind of putting it close to the device and transmitting that way. Or now the one that I had on would transmit to my phone from about 20 feet away through Bluetooth. And it's really convenient. It would alert me constantly about my blood glucose being too low at certain points. But you can set the alarms to be kind of what you think, what you want, what's a low blood glucose for you and what's high.
Right.
They aren't terribly expensive out of pocket. I think some of them are around $100, maybe a little bit more. But again, it's only for 14 days, so you're looking at $200 to $300 a month without insurance. Using it can be to someone, maybe especially older people who maybe aren't so familiar with. Although older people are getting pretty good with smartphones.
Sure. So the tech part may hold people back.
I think so, but compared to checking your blood glucose several times a day, I think it's pretty user-friendly.
Sure.
But if I had to say one thing was holding people back, it would be the insurance coverage. Talk to your doctor, see if the advantages outweigh what, are sort of the disadvantages of wearing a device all day long and having to operate it on your phone, and see what they say. I think it's definitely good for some people.
And we could talk for 2 weeks on the importance of keeping your blood sugar stable as it should be,
Sure,
right?
Sure, very important.
That's a whole other conversation.
A different conversation, yes.
Another conversation for another day. Here explaining the benefits of a continuous monitoring system for blood sugars with diabetics. Joining us here this morning is Dr. Jordan Thomas with Delta Health Systems.